With all of the people around the world that are struggling with diabetes, almost 500 million people around the planet, 37 million here in the United States alone. What do we do? How do we fix this problem? How do we get that life that we wanted, right? What we said, living long, living healthy. We're going to start talking about that in this episode tonight. So sit back, relax, and let's have a show. If you're new to me, this is Dr. Dwayne Wood. That's Wood with an E. The E stands for endocrinology. And here on the channel, I educate, I empower you, and I encourage you to take charge of your life, your health, avoid complications, and live the life you've always wanted, going to the next level. If you're new, you've caught us in the middle of a month of education. This is Diabetes Awareness Month. And so far for the month, I have done a show stepping us through diabetes as we walk through the causes, some of the complications. And tonight we're going to start talking about the treatment of diabetes. That's what we're doing. If you've not already done so, go ahead and look back at the shows that we've done so far. There is a playlist on the channel, and it's called Diabetes 101. Diabetes 101. And all the videos that we've done so far for this month are in there. And I want you to get back there, and I want you to watch them. And come along with us, come along with me as I step through different topics in diabetes. If you know someone who has diabetes, this is a great place for them to start learning how to take charge of their life. Remember, we want to live long. We want to live healthy. We want to live happy lives. And the first part is education. And that's what I'm doing on the channel tonight, educating. So I hope that you have been watching. Once again, if you've not been watching, go ahead and once you're finished with this video, this section, go back to the others and look at them and make sure that you are coming along. Okay. So let's go ahead and let's start stepping through what I want to discuss tonight. And that is talking about treatment, right? Because ultimately the question is, how do we go about dealing with the diabetes pandemic? How do we go about dealing with those issues? And the first part of what we talked about was, just dealing with what diabetes was, what types of diabetes there are. And in our last video, I talked about the proteins and carbs and fats and digestion and how insulin works and the complications that we run into when we don't have enough insulin. And tonight, I'm going to step a little further into diabetes. Okay, so once we have all of the background of how diabetes comes about, remember, we've said that diabetes is not a blood sugar problem, but diabetes is an insulin problem. You remember that? Diabetes is an insulin problem. So either we don't have enough insulin, that is type 1, where the beta cells in the pancreas are destroyed. And go back and watch that video if you don't understand those words that I'm saying, where the beta cells are destroyed. Or the cells are not responding appropriately to the insulin that we already have on board. And so the insulin, we're making more and more and more insulin, but because the body is not responding appropriately, then we can't do the things that we need to do, right? Remember that door we talked about? And actually, hold on a second. Let me do this. Give me just a second. I'm going to pull that back up. Let's see. Let's go ahead and pop this here. So I want to go ahead and I want to actually bring that slide back up and do just a moment of review. I wasn't planning to do that, but hey, this is what happens when you are doing a live show. You can decide to do things a little differently, right? So give me just a second. Let's get that. Let's see. Let's get that one out. Get that one out. And All right, there we go. I think I got it now. All right. Okay. So let's make sure that this does what I want it to do. Okay. Treatment of you. Okay, there we go. Yeah. So if you remember, we talked about the door, right? So we've got protein, fats, we've got carbs. Those go into the mouth, we digest them, and they get broken down into amino acids, fatty acids, and glycerol, and glucose, right? So remember, glucose is that big energy thing that we talk about. That's what the body uses to convert to energy so we can do all the things we need to do. Running, jumping, skipping, breathing, talking, right? Thinking, all those things that we need, the body needs energy for it. And when those components are broken down, in order for them to get through the door, right, into the cell where the cell can use them, we've got to have this thing here called insulin. And when insulin happens, when we get insulin, then we're able to open the door, we get energy, and then any excess that we've eaten goes into storage, right? Does that make sense? Right? So that's the process. That's the process. And ultimately, the goal for food is energy. The goal for food is energy, right? And when we talked about diabetes, there's this thing that we use as a marker of how the blood sugars are, and it is called the hemoglobin A1C. I'm going to pop to another video, another screen for a minute. If you remember, when we diagnosed diabetes, right? We had pre-diabetes or normal, we had pre-diabetes and then diabetes. And pre-diabetes is anywhere from 5.7 to 6.4. If you're 5.6 or lower, then you're normal. If you're 6.5 or higher, then you're considered to have diabetes. And the reason that we're doing this, long, healthy life, that healthy part, is because we know that if we can decrease our A1C, right? And I have to go all the way back to a couple of screens before, but if we can decrease the A1C, we can decrease the damage that it's doing, whether it's nerves or eyes or kidney, as we talk about type 1, and then for type 2, right? Heart attacks, eye damage, and kidney disease. So those are the things that we want to do. We want to prevent all of those as we're talking about living the healthy, right? So long, healthy, and then, of course, fulfilling life. So risk factors for pre-diabetes and type 2 diabetes, you'll see those there, right? And we've gone through this. There's other videos that we've done about it. But if you have pre-diabetes, that puts you at risk for diabetes. If you are overweight, that puts you at risk for diabetes. If you are 45 or older, it puts you at risk for diabetes. If you've ever had gestational diabetes or had given a birth to a baby who is over 9 pounds. If you're physically inactive, right? You hear what I said? Physically inactive, right? For more than if you do less than 3 times a week of activity, right? If you have a parent, brother, sister with type 2 diabetes. Now notice this is a lot of people. Right? So as I'm going through this list, you probably see yourself there. You see people that you know in this list because it's a huge list, right? It encompasses a lot of us. That's why it's such a big problem. If you're African American, Hispanic, Latino American, Native American, if you have non-alcoholic fatty liver, all those things put you at risk for prediabetes and then, of course, ultimately to diabetes. And this is, right, remember we talked, the last several shows, we talked about insulin resistance. And so insulin resistance puts you at risk for all of these things and then ultimately for the development of diabetes. What about risk factors for type 1? Because remember, type 1 is a different beast all of its own, right? So for type 1, family history. So having a parent, brother, or sister with type 1 puts you at risk for having type 1 diabetes. And remember, type 1 is where the body does not make insulin. Age. For type 1s, it usually develops in childhood, in the teens, young adults. Although now we're starting to see some people that are older. And then in the United States, if you're Caucasian, then you're at a higher risk for developing type 1 diabetes compared to type 2. So what are we doing? What are we going to do, right? And this one gives three things, right? The treatment options for diabetes. The treatment options for diabetes. And in some senses, the treatment options, those first two things that you see there, those are options for the treatment of pre-diabetes, insulin resistance. And we talked a little bit about that on our last show. Go back and take a look at that as well. So treatment options. Number one, lifestyle modification. Lifestyle modification. Lifestyle modification. Now that phrase is big. And we're going to go back and we're going to unpack that in coming episodes. What does lifestyle modification really mean? Yeah. It depends on who you talk to. But there are some general principles that we talk about, some general things that we say, okay, this is what we're talking about when we talk about lifestyle modification. And sometimes I don't like to use that phrase. Let me pop over to a big screen so you can see me fully. Sometimes I don't like that phrase because the phrase sometimes connotates that the person, right, is by themselves. Okay, you've got to go take care of your life. You got to go do some stuff on your own. Okay, there is a huge place for that, and we'll make an argument for that. There's some things that I have to take personal responsibility for. But it's kind of like when we're in school, right? I remember when I was in medical school and got through medical school and I got into residency. And there are all these procedures that we've got to learn, right? We've got to put in lines. We've got to learn how to intubate the person, put a breathing tube in. We've got to learn if someone has fluid on the lung, in the abdomen. We've got to learn how to take that out. We've got to learn how to take fluid out of a knee. You know, when you go to your doctor and your doctor puts that needle in the knee, right? They have to learn that somewhere. Right? So when your surgeon is doing surgery, they had to learn that somewhere. When I'm in my office and I walk into a room and I'm taking care of a patient and I'm diagnosing something or treating something, I had to learn that somewhere. And it sometimes strikes me as odd that there's all this stuff that we do, all this education that we do for so many other things, right? Because nobody would think twice about having someone come to learn something, right? You would not take someone, you know, say you've got a car, right? And some random person on the street wants to fix cars. You're not taking your car to them. They had to learn how to do that. Now, once they learn, you can use them, right? But we teach people how to do things so they can do it. But when it comes to lifestyle modifications, a lot of times we're like, okay, yeah, you go do it. We don't teach them. We don't give them tools. We don't give them, right? You're on your own. And so I sometimes don't like to use the phrase, but it is what we use. It's what we have. Okay, so we're going to use it, but we're going to unpack it a little bit and give some more power so that when we say lifestyle modification, it has some grit to it and you can get some traction when we talk about lifestyle modification, right? All right. So you got me on one of my little soapbox things. Okay, so lifestyle modification. And then non-prescription treatment. Non-prescription treatment. Now, I know there are a lot of you that are out there. I say a lot of you, but a lot of us that are out there. I'm gonna put myself in that category too. Who say we don't like medicine. We don't want to do anything with medicine. And there is a place for that. We talked about that a little bit. I talked about that a little bit in the previous episode when I talked about things that we can do to sensitize the body to insulin, right? Those insulin sensitizers that we talked about, right? Those are non-prescription treatments that was for insulin resistance. There are similar things for pre-diabetes and diabetes. Some of them are the same, right? And we'll add some more and really dive deep into those things. But non-prescription medication, there's a place for that, okay? And then medication, prescriptions medication. This is where your doctor writes, this is pharmacy, right? You write a prescription, you go to the pharmacy, you get it filled. So lifestyle modification, non-prescription treatment, and then prescription medication, right? Those are the three things that we have for the management of diabetes. Now, as I'm talking, there is another one that, and maybe I'll put that on the slide when we come back to unpack this some more. There is surgical treatment. And the treatment of diabetes is a consequence of the surgery, right? And in this case, we're talking, and we'll get into that. I won't add that here now. Okay, so treatment options, because ultimately that's the question. What are we going to do? Sure, all this theory is good. All this information is good. Now that I know about diabetes, now I know what causes it. Now I know what the risk factors are. What do we do about it? And so that's what we are getting ready to jump into as we come into our future episodes of this for this month, right? So we're talking about diabetes awareness. Awesome. All right. Well, let's hop over to our amazing question wheel. All right, so our amazing question wheel, if you're new to this, you'll see on the screen, we've got our questions on the wheel. These are some of the most commonly asked questions that people have sent in, and we've put them on the wheel, and I'm going to spin the wheel, and whatever question it lands on, that's the question I'm going to answer, all right? So no big deal. I've got to give you a concise, usable, practical, real answer, right? Can't be nonsensical. Here's the caveat. I've got to do it in 45 seconds. So whatever question it lands on, I've got to answer that question. I've got to do it in 45 seconds. And the reason I'm doing 45 seconds is once I'm done with the show tonight, I'm going to clip that out. We're going to make a little video on it, and we're going to post that on all of our social media platforms. Okay, so you are seeing me create this video in real time, right? First of all, we're spinning the wheel, we're answering the question. Later on, we're going to clip it out, we're going to package it, we're going to put it on our social media platforms. And let me hop over to the screen. What I want you to do is I want you to go find it, right? It's going to come out here in a little bit. I want you to go find the video, right, on the social media platforms. And when you find it, in the comments, I want you to put hashtag I was there. So hashtag I was there, right? So that's the plan. All right, so let's hop back over here. All right, so find hashtag I was there. So let's go ahead and let's spin the wheel and let's see what question we get to. All right, here we go. Boom. Spin. So round and round and round it goes. Where it stops, I don't know. I say that all the time, right? All right, let's see what question we have. We are on how long do you have to have diabetes to have retinopathy? Wow, that's a pretty good one. That's a good one. All right, how long do you have to have diabetes to have retinopathy? And I think I'm going to add to that question as well as hopefully I can do it in 45 seconds. So let's see. Let's get 45 seconds on the screen, and let's see how we answer this question. All right, and here we go. So let me read it again. How long do you have to have diabetes to have retinopathy? I think, I'm gonna answer it for just straight out like that. So how long do you have to have diabetes before you can develop retinopathy? The research has shown that for people who have diabetes, after about 10 to 15 years, you can begin seeing the complications of diabetes in the eye. This is called retinopathy. So about 10 to 15 years of having diabetes begins showing that retinopathy can develop. And that's why in early stages, we say we got to control the blood sugars so we can decrease the chances of developing retinopathy. Oh, wow. I came right up on the end, right? I think I was finished answering the question and then I just wanted to keep talking. So I think I may, that last part, I think I may cut that part out. But it was 45 seconds, right? Because you heard the applause come just as I finished talking. So amazing. Yeah, love it, love it. Okay. So anyway, so we're going to clip that out. We're going to go ahead and create that video, and then it'll be on our social media platforms. Go ahead and find it and put hashtag I was there. Hashtag I was there. Okay. All right. So diabetes continues to be a significant problem. It continues to skyrocket. We continue to have more complications. We continue to see more and more people suffering around the world. In this month, I am working to educate, to dispel some of the myths, and to talk about how do we go about getting to the point where we can live long, happy, fulfilling lives, decreasing the complications. That's what we started talking about tonight. The goal is the treatment, decreasing the progression too. And then if we get diabetes, how do we treat it? How do we treat it effectively? This is Dr. Dwayne Wood. If you are new to the channel, if you've been here on the channel, I educate, I empower, and I encourage you to take charge of your health and your life. Avoid complications, go to the next level. You hear me say that all the time, over and over and over. I want to grow this community. I want this community to be a place where you can come and get valuable information. I want this community to be a place where you can ask questions. I want this community to be a place where we, all of us, come together to help each other along the way in the process of developing strategies to get unstuck, to treat the illnesses that we talk about, to really do life together. That's it. I love that. I'm going to write that around. Really, to do life together, right? Do you have that one friend? Do you have that group that you hang out with that you guys are doing life together? That's what I hope for this channel, that we can do life together so that we all can avoid complications in our lives and in our health. In order to do that, I need you to subscribe to the channel. I need you to let everyone know that we are here. I need you to let me know what it is that you want us to talk about. What questions do you have? Where are you struggling? What successes have you had, so that you can share that with everyone else? Because as we do it together, right, we all get stronger. So if you've not already done so, go ahead and give us a thumbs up for this video, like it. If you've not subscribed, go ahead and create a free account on YouTube. Hit the subscribe button as you get into your account, and then the notification bell. Once you've done that, you will be notified. You'll be alerted for the things that we are doing. When I put new videos on, when I put new resources up, you'll get a message. And then share this channel with someone else and help them to subscribe, right? Because you remember that old commercial, I'll tell two friends and you tell two friends, and so on and so on and so on. That's what I want for the channel. That we grow, that we tell each other, hey, this is what's going on. If you're out there and someone is struggling with diabetes, go ahead and send them this series. It's on the channel. It's under the playlist Diabetes 101. If you're a physician, if you're a healthcare provider, send this to your patients. Let them know that we're here. Ask them to watch it. They can go through, and if there's a particular topic that you need them to cover, it'll be in here. Right? We're walking through. This is day number 16 as we're doing this, right? So day number 16. And so it'll be there. I thank you for being here. I look forward to engaging with you, right? If you're watching this on the replay, go ahead and put hashtag replay, and we will see you at the next video. Good night.